Every grocery store in America carries a $2 jar that doesn't just control gum disease, it actually reverses it at a molecular level. This isn't about temporary relief or slowing down symptoms. 1 tablespoon, swished for 20 minutes each morning, annihilates the harmful bacteria that destroy your gums, millions of them, before your routine is even complete. The dental industry rakes in over $150 billion every year. Periodontal disease, or gum disease, drives the endless cycle of repeat appointments, prescription mouthwashes, scaling and root planing, and surgical interventions. Half of all American adults over the age of 30 suffer from some stage of gum disease. That's 100 million people spending fortunes to manage a problem that a simple jar of oil can address permanently. Ancient Ayurvedic doctors in northern India employed this practice 3,000 years ago, meticulously documenting it in one of the oldest surviving medical texts. Modern clinical studies have since confirmed its effectiveness. In treated mouths, harmful bacteria can drop by up to 20% in a single session, not with a $100 prescription rinse, but with $2 worth of coconut oil. The dental industry doesn't publicize this because it works too well. This is the story of oil pulling, the 3,000-year-old method buried by modern dentistry. Imagine starting tonight with a simple, natural solution. No pharmacy, no dentist, just a jar from your local store in 20 minutes of your morning. Its origins trace back to around 700 BC in the Indus River Valley, today's northern India and Pakistan. Practitioners of Ayurveda treated patients with techniques known as Kaval Graha and Gandusha, 2 forms of oral oil therapy detailed in the Karaka Samhita. This medical text is so thorough it remains a cornerstone of Ayurvedic practice for millions today. The Karaka Samhita wasn't the work of a single author, it was compiled over generations, with successive scholars documenting clinical observations. The sections on oil pulling provide precise instructions. How to prepare patients, which oils to use, treatment duration, expected results, and conditions appropriate for each technique. This was clinical, systematic medicine, not folklore passed down by word of mouth. The text explicitly lists conditions that oil pulling addresses: bleeding gums, loose teeth, tooth decay, bad breath, dry throat, cracked lips, oral inflammation, and tooth and gum sensitivity. The physicians recorded real outcomes across generations, consistently finding that oil pulling worked. The practice didn't remain confined to the Indus Valley. Over centuries, traders and traveling doctors carried it into Southeast Asia, replicating its effects in local communities. During the Islamic Golden Age, from the 8th to the 14th century, Persian scholars translated these texts, incorporating oil pulling into their pharmacological writings. Medieval Arabian physicians documented the practice in medical encyclopedias that later influenced European medicine during the Renaissance. Even in West Africa, healers independently discovered similar techniques using palm kernel oil, arriving at the same conclusion. Plant-based oils applied to the mouth reduce inflammation, control bacterial growth, and preserve dental health. This convergence across continents, centuries, and cultures is striking. Independent observers using entirely different oils and traditions documented the same therapeutic results. The chemistry doesn't change based on geography or culture. The science is universal. In 1992, Ukrainian physician Dr. F. Karak presented oil pulling at a Soviet medical conference, recounting how it helped him overcome chronic blood disorders and arthritis over several years. His findings spread through European alternative medicine circles and reached Western media within a decade. By the early 2000s, controlled studies began confirming what the Karaka Samhita had recorded 3,000 years earlier. Journals including the Journal of Ayurveda and Integrative Medicine, the Nigerian Medical Journal, the Journal of Traditional and Complementary Medicine, and the Indian Journal of Dental Research published clinical evidence. Across continents, independent research confirmed that coconut oil pulling significantly reduces Streptococcus mutans, the main bacteria behind tooth decay. It lowers plaque index scores comparable to prescription chlorhexidine mouthwash, reduces gingival inflammation in patients with established gingivitis, and decreases the bacterial load linked to periodontal disease. Science was finally explaining why this ancient method worked, and simultaneously threatening a $150 billion industry that profits from treating gum disease rather than curing it. Here's how it works. Your mouth hosts over 700 bacterial species at any moment. Most are harmless or beneficial, aiding digestion, immunity, and oral chemistry. But a select group of harmful bacteria drive both tooth decay and gum disease. Streptococcus mutans, the main culprit in decay, metabolizes sugars and produces lactic acid, which dissolves enamel. Oil pulling targets these pathogens efficiently, offering a simple, low-cost method to restore oral health that modern dentistry prefers you don't hear about. The real culprit behind gum disease isn't a single bacterium, it's a community of destructive microbes, including Porphyromonas gingivalis, Treponema denticola, and Tannerella forsythia. These bacteria infiltrate the pockets between your teeth and gums, provoking a chronic immune response that gradually erodes the connective tissue and bone anchoring your teeth. Here lies the key structural principle that makes oil pulling so effective. These harmful bacteria are encased in cell membranes composed primarily of lipids, fat molecules. This is not a trivial detail. It is the foundational fact upon which the entire process depends. Fat dissolves in fat. This principle, known as lipid solubility, underpins why soap removes grease from your hands. One end of the soap molecule binds to fat, while the other dissolves in water to wash it away. When you swish coconut oil through your mouth, the lipid molecules in the oil physically attract and adhere to the lipid-rich membranes of the harmful bacteria. The microbes are lifted off your gum tissue, scraped from your tooth surfaces, and dislodged from your tongue. Suspended in the oil, they are captured and contained. Bacteria cannot adapt to this process. They cannot develop resistance. The physics of lipid attraction is immutable. Repeated exposure to coconut oil does not alter its effect. This is a mechanical phenomenon, not a chemical one, which means bacterial resistance. The nightmare that renders antibiotics eventually useless is irrelevant here. After 20 minutes of swishing, you expel billions of active bacteria attacking your gums and teeth. The oil visibly thickens and turns cloudy during the process. The transformation is real, a visible manifestation of bacteria being captured inside your mouth. Coconut oil provides a second line of defense thanks to its primary fatty acid, lauric acid, which comprises roughly 50% of the oil's profile. Lauric acid is a natural antimicrobial that independently disrupts bacterial cell membranes. It doesn't just trap bacteria, it kills them. Two mechanisms operate simultaneously: the mechanical extraction of microbes through lipid binding and the chemical destruction of any remaining bacteria by lauric acid. In a 2016 study published in the Journal of Traditional and Complementary Medicine, researchers measured Streptococcus mutans levels in participants practicing oil pulling with coconut oil for 10 consecutive days. Bacterial counts dropped nearly 20% compared to baseline. That reduction rivals the effects of chlorhexidine mouthwash in controlled trials. But chlorhexidine costs $40 per bottle, often requires a prescription, stains teeth brown with long-term use, disrupts the beneficial oral microbiome, and must be repurchased monthly. Coconut oil, by contrast, costs only $2, selectively targets harmful bacteria while preserving the beneficial species, and one bottle lasts 3 months. Here's what the dental industry doesn't want you to grasp. It thrives on a single economic principle. Oral disease must be managed, never cured. Consider the implications. Every prescription mouthwash is designed to run out in 2 weeks and be replaced. Each scaling and root planing procedure assumes the bacterial infection will return, requiring repeated intervention. Antibiotic rinses frame gum disease as a chronic condition demanding indefinite pharmaceutical management, rather than a bacterial problem with a permanent solution. Dental school curricula are built around cleaning, pharmaceutical rinses, and surgical solutions, not a simple practice costing $2 a month. The American dental market generates over $150 billion annually. Treatments for periodontal disease, scaling, root planing, surgery, maintenance appointments, prescription rinses, antibiotics, make up a significant share of that revenue. Roughly 50% of American adults suffer from some form of gum disease, creating a market of 100 million patients. 100 million people spending vast sums on management for a condition that a $2 jar of coconut oil can permanently address. Coconut oil cannot be patented. Lauric acid cannot be patented. The Caraca samhita is 3,000 years old. Its intellectual property expired nearly 2,970 years ago. No pharmaceutical subscription model can be built around a $2 practice that anyone can perform at home without prescriptions or professional supervision. Periodontal surgery practices cannot profit from patients whose bacterial load is permanently controlled by a daily self-care routine. Chlorhexidine at $40 a bottle cannot compete with a $2 alternative that achieves equivalent results. When a low-cost solution threatens massive recurring revenue, the response is predictable. The industry didn't ban it. That would acknowledge its existence. They didn't openly discredit it. The evidence is too strong. Instead, they simply ensured it remained absent from patient guidance channels. The American Dental Association never endorsed oil pulling. No major U.S. dental school teaches it as a primary intervention. Continuing education for practicing dentists ignores it. When patients inquire, the standard response cites insufficient clinical evidence, technically accurate in the narrowest sense. Large-scale, industry-funded trials with tens of thousands of participants do not exist. Yet independent, peer-reviewed studies do exist. Randomized controlled trials with human subjects consistently show statistically significant results across multiple countries and research teams. Evidence exists, but it is not funded by entities with financial interests, and the solution is coconut oil. In modern medicine, this distinction between industry-backed trials and independent research decides what is taught in dental schools and what is ignored. Still, knowledge never vanished. It moved underground, practiced by integrative medicine physicians, naturopathic dentists, functional medicine practitioners, and millions of individuals who discovered it independently and documented their outcomes. Today, over 40,000 academic citations link oil pulling to oral health outcomes in medical databases. The research is robust, published in indexed peer-reviewed journals, and referenced by accredited universities across continents. In 2004, Bruce Fife, a certified nutritionist and naturopathic physician who devoted decades to studying the therapeutic applications of coconut oil, published The Coconut Oil Miracle. The book explored extensive clinical evidence supporting oil pulling and reached millions of readers in over 20 languages, long before the mainstream dental establishment formally recognized the studies existed. In Oregon, a registered dental hygienist began recommending oil pulling to her patients in 2018 after conducting a meticulous review of the peer-reviewed literature. She remained fully within her professional scope, applying published clinical evidence directly to patient care. Over a 2-year follow-up, she recorded outcomes in patients who practiced oil pulling consistently for 30 days. The results were remarkably uniform. Patients experienced measurable reductions in pocket depth, the primary clinical metric for evaluating gum disease severity, alongside decreased gum bleeding and improved plaque index scores. Individuals reported enhanced comfort, fresher mouths, and reduced sensitivity. None of these outcomes required prescriptions, procedures, or anything beyond a simple $2 jar of coconut oil used for 20 minutes every morning. Within online communities focused on natural health and evidence-based alternative medicine, tens of thousands of documented cases demonstrate reversed gingivitis and improved periodontal measurements. These are not anecdotes. They are real people applying a defined protocol, recording their results at dental visits, and reporting what licensed professionals observed. The underlying chemistry remains consistent regardless of whether an official dental association has endorsed the research. Here is the method, and it is remarkably straightforward. Step 1. Purchase unrefined virgin coconut oil from any grocery store, health food retailer, or online supplier. The terms unrefined and virgin are critical. Refining processes that use heat and chemicals reduce lauric acid, the key antimicrobial component that makes coconut oil effective against harmful oral bacteria. Refined oils contain less lauric acid, while unrefined virgin coconut oil retains its full potency. A standard 16-ounce jar costs between $5 and $10 depending on the retailer. At 1 tablespoon per day, a jar lasts approximately 2 to 3 months, bringing the cost per treatment to roughly 7 to 15 cents. Step 2. Perform oil pulling on an empty stomach, ideally first thing in the morning before eating, drinking, or brushing. Overnight, bacterial populations in your mouth reach their peak. Food and drinks throughout the day dilute and disrupt the oral environment, so starting on an empty stomach ensures the highest bacterial concentration for maximum extraction. Step 3. Place 1 tablespoon of coconut oil into your mouth. If the oil is solid, which occurs below 76 degrees Fahrenheit, it will melt within seconds from your body heat. Swish the oil gently and deliberately through your teeth, around your gums, across your tongue, and over all oral surfaces. This is not gargling, nor is it vigorous rinsing like mouthwash. The goal is to let the oil navigate every crevice where bacteria reside. Continue for a full 20 minutes. The duration is intentional. The first 10 minutes allow the oil to reach saturation with captured bacteria. The second 10 minutes extract microbes from deeper gum pockets and more protected surfaces that the initial pass could not fully reach. Stopping at 10 minutes leaves the task incomplete. 20 minutes completes it. Step 4. When finished, spit the oil into a trash can, not the sink. Coconut oil solidifies below 76 degrees and can accumulate in pipes over time, causing blockages. Rinse your mouth thoroughly with warm water and brush your teeth as usual with your standard toothbrush and toothpaste. Step 5. Perform this routine daily without exception. Consistency is the variable that determines effectiveness. A single session removes bacteria. Daily sessions prevent microbial populations from rebuilding to levels that drive active gum disease. Within the first week, most people notice a cleaner mouth than before. After 2 weeks, the majority report reduced gum bleeding during brushing, a primary clinical marker of inflammation. When bleeding subsides, inflammation is receding. By 30 days, the bacterial load fueling gum disease is reduced to a level your immune system can manage naturally. The total cost is $2 to $3 per month. Compare that to a single scaling and root planing procedure, the standard professional treatment for moderate gum disease, which costs between $150 and $350 per quadrant. A full mouth treatment covers 4 quadrants, totaling $600 to $1,400. The bacteria return within weeks, requiring repeated procedures every 6 months indefinitely. Scaling and root planing remove calcified deposits, but do not eliminate the bacteria or restore the oral environment that prevents their regrowth. $2 and 20 minutes every morning achieves both goals. Throughout history, civilizations independently reached the same conclusion. Ancient Indian physicians knew it. Persian scholars translating their findings knew it. West African healers using palm oil knew it. They all discovered the same truth because it is embedded in the biology of bacteria that inhabit every human mouth. Lipid solubility chemistry is universal. It is not patented. It does not require prescriptions. It does not generate quarterly earnings reports. The bacteria responsible for gum destruction have been controllable for 3,000 years with a substance costing just $2. What changed is not the science, but the economic system built around pretending the solution requires expensive intervention. $150 billion in annual dental revenue depends on 100 million American adults believing gum disease is a chronic condition needing professional management. That belief sustains the entire market. A simple jar of coconut oil on a grocery store shelf threatens every dollar of it. This is not a conspiracy. It is arithmetic. Thanks for watching. See you in the next one.